Hi everyone, thank you for tuning in to this little broadcast webinar for the Valley Wellness Committee meeting for this quarter. We appreciate you taking the time out of your schedule to meet with us over this webinar and just guide you through some of the upcoming challenges and activities that we have for this year. As you all know, the program hasn't changed for this year incentive-wise, but we did want to lay out a few extra communication pieces for you, and then hopefully you can provide any feedback or comments after in the survey below. So just a reminder of this year as compared to last year, 40% of the participants, that would be the employees, participated in the annual physical. We had 44% of the spouses complete. Comparing to 2016, we had 42% and 38% of these, or 38% of the employees and 42% of the spouses. So it went up just about 2 percentage points for both groups.
And as far as the wellness passports, they did go out on February 12th. We sent them out to 488 households, also with the EEOC letter. And this year we're trying something a little new. We're trying to capture the spirit of the wellness journey. We've got a gal on there with her backpack and she's ready to take a journey. And we're just really trying to create a culture of being more active and choosing better foods. And also we wanted to make the deadlines really clear. And also in the yellow box, we wanted to direct every participant to the wellness website, because not only can they see when their wellness, they get credit for their wellness passport, but there's a lot of other things on the wellness website that'll really help them. And then on the actual biometric screening form, we just simplified it. We just made it very plain and simple.
And this form just makes it easier for not only the physicians to fill out, but for the participants to see the incentives just straight and laid out, and then for us to intake as well. Just looking at this year, of course, we always want to hit the first threshold, 45% of the employees participating. It would just take about 16 more participants as compared to this year or this previous year to participate to just earn that $1 off the weekly co-premium for 2019. Of course, they could hit the 50 or 60%, and we'll always shoot for higher. But if we could at least hit that minimum goal, I think it would really ramp up the morale for the group in regards to the incentive. Again, the next slide is just looking at the 2019 wellness incentive. Just remember that when they are doing this their biometric screening or physical, they're earning it for the following year. So it's applied towards their weekly co-premium if they earn the group incentive for 2019. And the dollars go off the deductible for 2019, but they do not roll over. They just strictly earn that at the beginning of the following year.
When we look at the wellness calendar, the communication calendar, you can see that we've got them covered each month as far as mailings, postcards, emails, robocalls. And new this year, we're really ramping up the challenges, the activity challenges, which Eric will talk more about. But yeah, we're going to, continue to keep them informed and let them know about their wellness deadlines and the benefits to complete a wellness passport.
The first challenge we have coming up is actually pretty soon. Registration starts April 2nd and goes through April 22nd, and it'll start running April 16th. This is Spring into Motion. It's basically tracking your activity, tracking the amount of exercise minutes you get each day or each week. We'll have random drawing prizes throughout to keep them engaged and tuned into the Spring into Motion activity challenge. And it'll be run through the wellness website that's basically organized by Health Fitness for us. The second challenge that'll go later on this year, it actually follows the month after. Registration will start May 28th and run through June 10th, and the challenge will run from June 11th to June 22nd. This one's more focused on just nutritious eating, healthy eating, trying to get a lot of colors in, trying to focus on those fruits and vegetables, and make some really good choices. Coming up to the end of this discussion, we just want to go over some of the items that are left in the open. There's been a little bit of transition out in the Valley, so we're just trying to figure out exactly for the Wellness Committee if there's any discussion items that we need to confirm. Some of the things we have on our list are the Wellness Champion store visits, as you all may be aware of or may not have heard yet, but Ruthie Gilday was our Wellness Champion for 2017 and 16, and she has retired, which is a good thing. Happy for Ruthie. We've talked to her a couple times, but we're glad for her. But that leaves a vacant spot on the Wellness Committee, A, for the stores up north, but B, also as the champion for that area, just really driving home the wellness program so that everyone's aware of it, understanding the forms and what they need to do to earn the incentives.
We're also wondering about the primary care physician lists. We pretty much provided that for several years in a row. We're just wanting to make sure they're still beneficial and wanting to make sure that Julie, will be in charge of distributing those, or whether whether Kevin will do it. We just kind of need to figure out who's going to do it if you want to do it. And then another item for the communication piece is that we no longer have access to the Valley Private Group Facebook page. Our personal account, Facebook removed it because we had to produce a driver's license, and we don't have a driver's license for Heartland.
Yeah, we'll lose a little bit of our direct communication in terms of Facebook. And of course, we're always reaching out by email or phone, etc. But it is nice to have different avenues to communicate with. Just finishing up the discussion, we always set our goal for the year. Of course, we want to increase to that minimum threshold of 45%. We've gotten there once before. I think we can get back there again. I'd love to get the group earning, at least $1 off their co-premium for 2019.
And as far as we would be interested in any ideas that you might have for things that might work in that area to promote, to campaign, to promote, to get people to get 16 friends to complete the screening and the exam.
Yeah, if there's any connections or avenues through the employer side or the union side, either way, if we can use any of those modes of communications to really push and drive home the program. I think everyone understands it. I think the group's aware. There are some strains around the program for those who already have pre-existing conditions or managed conditions. It can be hard for them to get their wellness visit completely covered. So that runs through our goals in the wellness program. And again, we thank you for taking the time to listen to this, and we appreciate any feedback and comments you have if you could just leave them below.